The opinions and statements expressed in the following program do not necessarily reflect those of WWDB, its staff, or management.
Good day, everyone, and welcome again to another edition of Boomer Generation Radio, coming to you live from WWDB AM 860 here in the greater Philadelphia, Delaware Valley area, and streaming live on WWDBAM.com. And this portion of Boomer Generation Radio is brought to you by Kendal, a system of not-for-profit communities and services located in 8 states in the Northeast, Mid-Atlantic, and the near Midwest regions of the United States. Kendal advocates for and is committed to working with others to together transform the experience of aging. And to learn more about Kendal, which is Kendal, visit kendal.org or call them toll-free at 888-759-0128. That's kendal.org, Kendal.org, or toll-free at 888-759-0128. And we are pleased to welcome on the Kendal segment of Boomer Generation Radio, Mark Bruley, the Vice President for Accident and Forensic Investigation for the ECRI, right? ECRI Institute here in Plymouth Meeting, Pennsylvania. Mr. Bruley, welcome. You're a biomedical engineer.
Yes, I am.
And also serve as a member of the outreach board at Kendal Senior Living. So welcome, welcome, welcome.
Thank you for the invitation.
And a biomedical engineer and accident and forensic investigation. We talked a lot in the last couple of weeks and indeed in the first segment about people staying at home, people being cared for at home rather than going into a facility. And if I'm not mistaken, your world of interest and universe deals with the devices that people may be using at home to keep them safe and to bring them back to health, or at least to monitor health. Am I somewhat correct in that?
Yes, in large part you are. We deal with all of the aspects of healthcare technology, including those that are used in the home. You know, over the last 15 years or so, more and more extensive care has been provided to patients in their home after a short stay in the hospital, including care given in senior living communities. And that type of home health care is being delivered by family members or by visiting nurses and or by the patients themselves. And the new technologies that are moving into the home care settings are used for providing monitoring or therapy or care or diagnosis or just general care. So
I have to ask this question as someone who's technologically challenged. How, because you just mentioned that some of these devices now the patient themselves are using by themselves, other than mom or dad or the caregiver or the wife or the spouse or the adult child. How challenging is this? Do you need a degree in engineering to work these devices?
Well, it can be quite challenging for the patient who is not well equipped to understand the technological aspects of how to operate the device, such as a breathing ventilator or a blood glucose meter.
Wow.
Or other types of medication pumps that are used for treating pain, chronic pain. And the user manuals for these are not necessarily written for the patient themselves.
Are they like computer manuals that you need either a 10-year-old who speaks this language or you're out of luck?
Well, they start off with the warnings and precautions before you even get to see how to operate the machines. But it is difficult and a challenge for the patients themselves and their family members to be able to easily get these into use in the home care setting and to safely use them and monitor their adequate performance over time.
What does the Institute do? It's ECRI, right?
At ECRI Institute, we're a nonprofit corporation based in Philadelphia that studies the best ways to improve patient care with a focus on medical technology. And that includes investigating accidents that happen with medical technology in the hospital setting, the surgical setting, and the home care setting. So
let's. I want to pursue that. So you investigate something, there's a glitch, something goes wrong in the hospital or nursing home?
Yes, we do. That's the aspect that I direct at Eckery Institute. We're somewhat analogous in part to the comparative evaluations that are performed at Consumers Union. We test and evaluate medical equipment, publish monthly brand name comparative ratings of which ones are best. We also publish hazard reports on specific devices used in hospitals and homes. As it relates to the accidents, soon after an incident occurs, we are a known resource within the healthcare community and the long-term care community as a go-to place for guidance, either just telephone guidance or on-site investigation to help understand what happened and how to prevent it from happening.
So if I'm at home and I have someone who's coming home from, let's say, the hospital or rehab, and they're going to have to use one of these devices, and I want to know how safe they are, or can I log on to your website and find that information out, or is this totally, for the medical community?
There is some patient care related information on our website for free. Mm-hmm. Most of our work is for the medical community, so that recommendations that would come from your physician or your hospital on what technology to use at home, such as an oxygen concentrator or blood glucose meter, resources for that information would be available through the hospitals that are members of our various information systems and programs. And you test you use the Consumer Reports analogy. Yes.
You test these devices.
We test them in our laboratory in Plymouth meeting. We have about 400 people there.
Oh, wow.
And the technical folks who deal with the comparative evaluations and the accident investigations number about 30. The rest of the staff deal with helping healthcare facilities and agencies purchase the best equipment and to do technologies assessments of new technologies that come out.
Now, I imagine, since this is your business every single day, given what we keep hearing, that more and more people are being taken care of home, that there's this, how do we train mom or dad or adult child to use these devices? I mean, is there a glitch in the system there somewhere? Because just talk to me about that.
Richard, that's a very interesting point. It's really a largely ignored area in regard to home care from our perspective. I mentioned already that the manuals are not necessarily written for home care use of some of these devices. So if a patient's going home to do dialysis at home, which is becoming more popular,
right,
they have a home dialysis machine for peritoneal dialysis as an example, or they have the breathing ventilator, which is literally breathing for them, and how these are properly set up, including how they are set up with the accessories. A breathing unit, for example, a ventilator, has the tracheostomy tube in the throat. It then has a corrugated tube that goes to the breathing ventilator itself. Those are accessories. How all these fit together and how they work properly and how the alarms are set for alerting the patient themselves or their caregiver that there's a problem are critical issues. Where to go to get information on this, in part relies, or the home care provider or the patient would have to rely on who's providing that, such as a durable medical equipment company, the rental company that's providing it, as well as in many cases now the home care nurses are quite astute and familiar with how to set up the equipment. But if you have a caregiver there when that home care nurse is there and that caregiver is only there 3 days a week, and that person may have been trained by the home care nurse, the other family members may not have received that same level of training.
Yeah, I'm just thinking, so God forbid something, 1 o'clock in the morning, an alarm goes off because the person maybe turned the wrong way in sleep, or,
yes,
or just had just a little glitch, as everybody does, and move something and something goes off. How do they work? What do you do?
You bring up the issue of alarms, and that's a critical issue in the home setting. When you turn on your alarm clock, that's on your nightstand or in your bedroom, and it will typically awaken you. If you're caring for someone who's 2 doors down the hall and they have a medical device that has an alarm, when that alarm sounds in their room, it's not likely to alert you. They may be in distress. They may not be able to react. So the issue of what are called remote alarms is critical for those life-saving devices or life support devices, such as ventilators. Many have remote alarm capabilities such that the patient's being cared of in one room, and there can be an alarm next to your bed that will alert you as a familial caregiver to distress that patient may be in.
Are any of these machines hooked up to like the care providing company or the medical device providing company, that if something goes wrong in the middle of the night, it automatically triggers an alarm, like, somebody breaking into your house?
Not that I'm aware of.
Wow.
Not that I'm aware of.
Something that somebody should invent or something.
No,
that just occurred to me while you're talking about that, because God forbid something happens in the middle of the night. It's
well, God forbid, but there's a response time issue.
Yeah.
If your ventilator stops working, you may not be able to be resuscitated a minute and a half later. And so it really relies on a family caregiver for a critically ill patient or a seriously ill patient being cared for at home to be able to respond. Or home care nurse.
No, you raised this is it's kind of a frightening conversation, given the fact that more and more people are being treated at home, and we're a lot of baby boomers themselves saying, I want to be home, and I'm just thinking of several people I'm thinking of right now who have had issues, who have come home and are being treated at home, and this dialysis thing. Is really that's really growing, isn't it? The people having home dialysis.
It is, especially a more simple version called peritoneal dialysis, where a fluid is circulated through your abdomen, as opposed to the larger dialysis machines. There's a lot of accessory equipment that has to go along with such dialysis: the tubing, the chemicals, the waste bags, everything. It's not a simple issue. However, in the home care setting, you are not now typically exposed to the level of potential infections that you might catch in the hospital itself.
Right. You mentioned that before we went on the air, that's the upside of this, that,
right.
There's maybe not be MRSA floating around or something.
Right. There are other issues of safety, especially with the vastly increasing use of oxygen concentrators in the home. These are small machines that about the size of a footstool, and they concentrate oxygen from the air, and it's delivered typically through a 50-foot long tube to the nose cannulas on a patient. The hazards relate to fire when you're cooking, fire if you are still smoking. There are we investigated a fatal fire involving that about a year ago, and it was all related to smoking.
With the oxygen?
The oxygen on the patient's face. But there's also the issue in the long-term care facilities of chafing dishes at a buffet, if you have portable oxygen.
I never thought about that.
Or fireplaces in a nursing home, or cooking yourself in your senior living facility.
One of the things, so you talked about these issues that can be of a danger, so the oxygen and the ventilator thing.
Yeah.
So I've visited lots of people, as just about every clergy person has, at home, and they'll move the hospital bed into the family room or downstairs with railings and
Beds,
stuff.
Yeah.
Yeah.
Bed rails.
And does that present its own danger?
Yeah. Unlike home dialysis or ventilators, which are reasonably high tech, bed rails are about as low tech as you can get, but they are very, very high risk.
Really?
You would not necessarily think so. In 1999, the FDA, the Food and Drug Administration, started a work group on bed rail safety. I've been on that since its founding, and it has explored and published very useful information, both for healthcare providers as well as home care givers and patients, on the safe use of bed rails and the better ways to evaluate whether you even need a bed rail, either in the hospital or the home care setting. The hazard involves entrapment, either within the rail or between the rail and the mattress. And the FDA data, when we began looking at it 13 years ago, there were scores of patients every year in the hospitals who would fatally suffocate when becoming entrapped between the rail and the mattress.
Wow.
And there has typically been a misperception that hospital rails will help keep a patient in the bed. And that's not proven to be true by any evidence or any study.
Wow.
And
we're speaking with Mark Bruley, a very, very honest conversation here. Mark, the Vice President of Accident and Forensic Investigation for the ECRI Institute here in Philadelphia. And this is a reminder that this portion of Boomer Generation Radio is brought to you by Kendal Outreach, serving the field of aging by raising public awareness and advocacy around important issues of older adults. Through education, training, and implementation of comprehensive approaches to safe, individualized, long-term care practices, Kendal Outreach has been sharing Kendal's approach to quality care with consumers, advocates, providers, government agencies, and related organizations since 1989. To learn more, we invite you to visit kendal.org. That's KENDAL.org, and click on Outreach. That's Kendal Outreach. And the number, the website again is kendal.org. And for information about the Kendal Outreach, go to the website kendal.org and click on the icon Outreach. And we're back with Mark Bruley, the Vice President for Accident and Forensic Investigation for the ECRI Institute here in the greater Delaware Valley. You're based in Plymouth Meeting?
yes, we are. Yes.
Just up the road. And you're a biomedical engineer.
I am.
And you've been doing this for several decades.
39
Wow.
years.
Well, I was going to say, I don't want to.
Well, thank you.
A couple of years. You've been doing a couple of years. And you lecture on this around the country? And
around the United States
Right.
as well as internationally. I just finished up giving a 2-week course to biomedical engineers and regulators from the Saudi Arabian Food and Drug Administration.
Wow.
And
Where? Over there or here?
At our offices in Plymouth Meeting, Pennsylvania. But we've given that course in Canada, China, Malaysia, Singapore, Australia.
So biomedical engineer, you're the person who develops, designs, and engineers a device, a medical device?
Well, biomedical engineering does involve understanding human anatomy and physiology, as well as the life sciences and the physics and engineering aspects of the physical world. So we are the link between the healthcare community and the design and manufacturing community. We walk comfortably and speak comfortably in both worlds.
So you get involved then, as you mentioned before, in investigating when one of these devices has a little hiccup?
Yes.
Okay.
A serious or fatal hiccup.
How does that investigation work? What do you do? How do you get called in by a hospital or a care facility?
Typically, it's the hospital itself, whether acute care, long-term care, or surgical center. They will call us in frequently the same day of the accident to help them understand what went on. We inspect the equipment involved. We recreate the setting for the equipment because the physical relationships between the user and the equipment and the patient and the equipment and the accessories and the equipment and the hospital setting itself are all important to investigate. If you simply take a device out of that system of 4 links that I just mentioned between the user, the patient, the accessories, and the hospital, if you simply test the device, that's not doing an investigation, and it usually checks out fine. So we also talk with the personnel who are using the device, and we determine what happened, come to a root cause, and make recommendations for prevention of that type of accident. It's quite worthwhile. It's unique for an engineer to have, I think, such a positive impact on patient safety and society coming right out of college as I did years ago.
What got you into this? You went to school. You have a
Temple
degree?
University in the biomed program.
Mighty Temple Owls, good for you.
Yeah.
Me too. But your degree was in engineering?
Biomedical engineering technology from Temple University in 1975.
Wow.
And
so you walked right into this.
I came right out of college into
you.
this. In fact, Eckery Institute hired me before I even graduated.
Oh, you're very lucky.
And I was quite lucky to have a job in my field before graduation.
So obviously you're familiar with all the technology and the technological innovations that and I'm sure in the course of the 39 years you've been doing this, you've seen unbelievable strides, I would assume, in just miniaturization and the way these devices are used and the safety of them. So I have to ask you this question. Moving forward, putting on your biomedical engineering hat.
Yes.
Do you foresee a time, almost Star Wars-like, when these machines will be so miniaturized and push-button accessible that they'll be safer, really safer and easier to use and more miniature without all the cumbersome types of equipment?
Well, the higher tech medical equipment, such as breathing ventilators, have certainly become much, much, much smaller over the last 30 years or so. And importantly, from a safety standpoint, ventilators and blood glucose meters and other high-tech devices that are used in the home, they have a self-check feature and internal self-diagnostics that are always running to determine whether there's a failure with the device. So when you first turn it on, it usually runs through a check to make sure that it's functioning properly. And then if there's a failure during use, it may alarm, either for a machine alarm, such as a integrated circuit failed, or, of course, for the patient alarms of an occluded breathing circuit, for example. So things are getting safer as we move forward. The nanotechnologies that are coming forth in regard to new materials and synthetics have a great potential, but those are a number of years away.
I have to ask you this question, and I'm not a scientist by any stretch of the imagination, but I find this fascinating in the way technology is developed. Do you ever see a time when you take out your phone and there'll be some sort of app or thing that you could just put on your body that would almost do a self-diagnostic?
There are some devices like that already.
Are you serious?
That you wear a controller on your wrist, and there are electrodes that go around different parts of the body. I saw it for the first time, I think, 2 summers ago at a national clinical and biomedical engineering conference, that you would wear it all the time, and it would link through Bluetooth to a controller and to a diagnostic system for more extensive monitoring. That's
I've seen these bracelets.
Well, the bands on the bracelet. This is much more extensive for monitoring your heartbeat and arrhythmias that may occur. These are wearable technologies.
Are they online now? I mean, are they commercially available, or is this still
for hospital use, not for home use?
For home use. Do you ever think that's going to happen?
I think with all the apps, as they call them, for cell phones and Bluetooth linkage, certainly there will be a lot more monitoring as it relates to.
That would be so cool.
What you think your body should be doing versus what it is doing.
Yeah. I have that conversation with my body all the time, usually trying to get out of bed in the morning, where I want, my brain says one thing and my knees and my ankles said, not so fast, not so fast, not so fast.
Okay.
So before we start running out of time, what for the boomers perhaps who are home and facing the challenge of having to take care of a parent or a spouse, or even, God forbid, a child, because we've run into this also, and at home, and bringing this equipment into the house. What are the 3 most important things that I, as that caregiver, are going to have to know?
Certainly understand what your resources are for knowing how to work the equipment that you have been told is needed in your home. If you can't understand the manual, get recommendations from the home care nurse as to how to use the equipment. Get something written that's in easily understandable language. As it relates to bed rails, I recommend that people go on to the internet, Google, for example, and just type in 3 words, FDA, as the initials, FDA. The next word would be bed and safety. FDA, bed, safety. And you'll see many links there related to how to first critically assess whether bed rails are needed for your loved one. Second, if you're going to get a bed from a rental company, you should try to make sure that that bed meets the guidance recommendations from FDA for safe rail design.
And just well, go ahead. Don't do the third one. I just want to come back with one other thing.
As it relates to alarms.
Yeah.
If your loved one has an alarm on their machine in a different bedroom, find out whether there's a remote alarm that you can place in your bedroom so that you will be alerted to a critical or life risky condition when that patient is on that device.
Real fast, because we only have about a minute and a half left in this segment. The difference in beds. Are there significant difference in beds that people need to bring a hospital bed into their home? Are there gradations of quality in that?
There can be, but you have to understand that in many cases the bed mattress is not made by the bed frame company. So it really depends on what type of positioning is needed. More critically, though, you need to assess and understand whether your loved one or yourself needs to have a real bed rail as opposed to an enabling rail, which is a small thing, almost like a U-shaped cane that would attach to the bed frame to help you get in and out of bed. Those are not bed rails. They typically do not have the same hazards of entrapment by any means as a regular bed rail does.
Real fast, walkers. There's so many people I see. Do you test or evaluate different brands of walkers?
We had done that about 20 years ago. We have not updated that, though. We
Okay.
had evaluated walkers some time ago.
Well, so this is a reminder that this portion of Boomer Generation Radio has been brought to you by Kendal, a system of not-for-profit communities and services that advocates for and empowers older adults to reach their full potential. Together, we're transforming the experience of aging. And again, to learn more about Kendal, which is Kendal, visit kendal.org or again, toll free at 888-759-0128. And we've been delighted, and thank you very, very much again, Mr. Mark Bruley, the Vice President for Accident and Forensic Investigation at the ECRI Institute. Lots of very, very important information. Really, really thank you.
Thank you for having me, Richard.
For coming in and talking to us about these medical devices at home and how to take care of our loved ones and where to go for help and things to be careful of. Thank you very, very much, Mark. Have a great day. To all of you on Boomer Generation Radio, take care. Have a great day, and we'll see you next week.